right, let's just get her down so she's comfortable.
All right, come on down.
And we're going to have you just lie down. Now, Anne had a toric lens, and this is basically a staged procedure.
Okay.
And as you can see, I don't know what you can see downstairs, but she's basically, with the wave scan today, she's minus 0.03, so we hit right on with her spherical correction, and she has 3.17 diopters left. After the cataract surgery with the toric lens, she had over 5 diopters preoperatively, so we did correct the maximum we could with that lens at that time, and now we're just going to tweak her. The only one potential tricky thing with some of these premium lenses or any intraocular lens in performing laser vision correction afterwards is sometimes it's hard to get the IR, the iris registration. So it may take a little time for that. And how are you feeling, dear?
Good.
You relaxed?
Yes, thanks.
All right, so you're going to feel a little pressure on your eye. Let's just separate your eyelids. I'm going to give you a little target to look at, which would be Steve's finger. Just take a nice deep breath. Breathe through your nose. Relax. Excellent. Okay. You see Steve's finger there? Just try to stay right there. I'm just going to separate your eyelids right now. Look up a little bit. Right there. Excellent. Suction on. Perfect. It's important to make sure this is aligned. Let's just bring this down. Just going to line the docking up. And dim the lights, please, in the room. That's great. Thank you. I think she looks great.
That's great, too.
Okay. We're good, Marguerite. So now we have a 9mm flap. She has smaller eyes, so we're going to get a little OBL here superiorly. See the flap is being made perfectly. Everything looks excellent. 5 more seconds, 4 more seconds, 2, 1. Excellent. The flap is made. It's a 9mm flap, which is just grand. Everything looks beautiful, dear. Go ahead, Marguerite. I'm sorry.
You're so quick.
We're going to give you a little drop there. Now just close your eye. There you go. Just going to let this sit a little bit. You're doing beautifully. I'm going to take the tape off your left eye. Now, because of the OBL, we're just going to let it sit a little bit, let these bubbles just kind of dissipate, be easier for the tracker to work. Hang on 1 second. All right, darling. Just ergonomically, if you're doing a lot of cases in a day, you don't want to be stretching or leaning over all the time. One anecdote is when Ted and I were first talking about doing this seminar, I had just had rotator cuff surgery, and I didn't even know if I'd be able to operate in this month, so I'm thrilled to be here. You're doing great, dear. Just relax. I'm at the lowest level. We're going to have to just raise her up a hair. Okay. Open your eye. So just by massage this, you can sometimes dissipate some of these bubbles. As you can see, the diameter of her cornea is tiny, and that's why she probably had so much astigmatism. And that's why you get the OBL. The closer you are to the limbus, the more likely to get some OBL. Okay, dear. Look at the blinking light. Can you find that? With your left. We're gonna cover your left eye. Now just close both eyes, dear. Excellent. You okay?
Yes.
You're doing beautifully. Just lining her up. Fine, I'm going to separate your lids a little bit. Open your eyes, your right eye. There you go. All I'm doing is really just pulling back some of your lashes. I'll just keep these out of the operative field. Go. Do you feel the pressure here? Now she has a small orbit also. Put your chin down for me, dear. You see the blinking light? Excellent. I'm as low as I can go. I just need to raise her up a little bit more, please. Marguerite, okay. Just trying to get to the best view of this I can. Try to go around this a little bit. Now with this, I'm going to lift very gently. You can see with a 9mm flap that we have a small corner. You're doing great, Anne. I'll just flip that over a little bit. Looks beautiful. Got it?
Got it.
All right, dear, we're just going to line you up a little bit. I'd like to just clean off the edges so we don't get any epithelial ingrowth. Everything looks really sharp here. And this with an intraocular lens is sometimes a little harder to do, quite often. So we'll dim the lights as best we can.
Calculating.
Okay, we're lining you up, dear. You're doing great.
So it's going to grab that eye.
Yeah.
Okay, sir. You have
All right, we're
25.
excellent.
1 sec, sir.
All right, hang on, dear. All
You
right,
are all set.
all right, just
2, 5.
bear with us, dear. You're doing beautifully. Everything looks great. You're doing beautifully.
20.
You can see the bubbles kind of dissipate now with the treatment. These will have no effect on our ultimate refraction. You're almost done, dear. You're doing really, really well. You're doing great. You're almost done. There you are.
Complete, sir.
You did beautifully, dear. Just bear with me. You're going to feel a little fluid now, maybe coming down by your ear a little bit. So I'm just going to gently float the flap back. These bubbles will all disappear shortly. When the interlace first came out, you could sometimes see bubbles in the limbus, sometimes even in the anterior chamber. So right now I'm looking at the margins, make sure there's no debris or filaments or anything that may have come underneath the flap. And just clean up any saline that we have here. Flap margins look great. Try to just zoom in for you a little bit. The toric lenses have 3 little dots on the axis, and unfortunately she's not dilated, so you can't see that, but that's kind of how you line it up intraoperatively. So now I'm going to just put a little Pred Forte on the eye, and I'm looking at the margins, and everything looks very, very symmetrical. Looks like it went back perfectly. So I can comfortably say she's going to have a great result, and you're going to be very happy. I use a little antibiotic, a little steroid, either Predforte or Durezol. It's great. And then obviously we'll give them lots of teardrops. She's had teardrops preoperatively. She comes from out of state, so I want to make sure she's a very happy lady. Excellent. So I'm going to take the speculum out now. I'm going to take this off gently. Just gently close both eyes, dear. You're doing great. Sorry about the tape there. Okay. You can take a nice deep breath. Do not worry about your vision today. It's going to clear up by tomorrow morning. It'll clear up this afternoon. So I'm going to get you out of this area here. And you did beautifully.
Great.
Now I'm going to help you sit up. I'm just going to protect your back here a little bit. So I'm going to, you can slowly sit up. And you are on camera, my dear. Well, let me get a picture with her. My God. Steve, you get over here too. You have worked, this guy has worked his tail off. He and I were here till 8 o'clock last night, and he was here at 5 o'clock this morning. So, you in there?
Yes, sir.
Smile. Okay. All right. Beautiful.